and feel free.
Okay. All right, this meeting is called to order. Good morning and welcome. Due to COVID-19, the board has agreed to meet via Zoom only through the remainder of this season. And we're going to do roll call to identify board members that are with us today. And I just want to throw one thing out where normally Dave and his team are all in one room, but today they are in separate locations. So we might have a little bit of coordination issues going on. So just sort of bear with us. We're going to get through it. It seems like after 2 years of Zooming and teaming, we would have it 100% down, but it's a little more complex than that. So I appreciate that. First up, Terry House.
Good morning.
Morning, Terry. Allison Polson.
Sorry, couldn't get myself off mute. I am here.
Morning, Allison. Pamela Cruz.
Good morning.
Morning. Pete Cutler.
We're still checking on Pete, but we'll announce him when he joins.
You got it. Carrie Schaefer.
Good morning.
Morning, Carrie. Amy McGuire.
Good morning.
Morning, Amy. Donna Hanson-Murray.
Good morning.
I like your name. I love the way it just kind of rolls off.
Thank you.
Nice. You're welcome. Dan Gossett.
Good morning, everyone.
Morning, Dan. And also, I hope I pronounce this right, Dana Higler from the AG's office.
That is correct. Absolutely correct.
Awesome. That makes me feel good. And I'm Lou McDermott. I'm the chair of the SEBB board and the deputy director here at the Healthcare Authority. With both board members and presenters attending virtually, it's really helpful for the board to hold their questions until each presentation is done or when the presenter pauses to ask if there are questions. Board members will also be watching to see if you throw up your Zoom hand to indicate you have a question, and the public's going to have an opportunity to provide general comments at the end of the meeting during the public comment period. Dave's going to go ahead and give us an overview of today's agenda.
But I'm going to start with acknowledging Pete's hand because I think
That's
Pete
right.
is announcing he's here.
Yeah, yes, thank you. I apologize for being a little late.
Pete, were you getting a cup of coffee?
I'd like to say I was, but no, it took me 3 times to find the right Zoom link.
All right, well, I'm glad you're with us, sir.
Good.
You just missed my intro. Not a big deal. You've heard it a few times, and the important stuff's coming up from Dave.
Well, every moment is important, but I'm like,
All right, well, good morning, Chair McDermott, members of the board. I'll start off with today's overview of the agenda. We have back for you a couple of resolutions specifically related to the Uniform Medical Plan High Deductible Plan. That's that IRS qualified plan. There are 2 resolutions that were presented at the board meeting earlier this month that we'll ask you to take action on today. And then there is a new resolution related to UMP that Jenny Switzer will introduce that we'll ask you to take action on next month. After that, we will have a presentation from Lauren about some plan proposed changes specific to the Kaiser Washington options part of the portfolio. Lauren started off this month describing potential benefit changes for the vast majority of the portfolio, but there was one piece that just wasn't quite ready yet. And so we're bringing that to you today. That would be part of the overall package of plans and rates that are brought to you next month. Then we'll have some public comment and close out. And I do want to announce for the public that although we had anticipated that we might need an executive session, we don't intend to go into executive session with the board today. So the meeting will be, that you can strike that from your agenda. I also want to highlight that the background that we're using as our board material today for the agency comes from Clallam County. It's fir trees, also honoring some of the other natural features of our state. So it's in the Lake Crescent area in Clallam County, and just wanted to continue to highlight different parts of our state in our board meeting. I will just go ahead and go into the follow-up from the last board meeting. I just have one piece of information that I wanted to give a little bit more specificity on. And there was a question that Pam had asked in the context of dental coverage about some specifics on crown coverage within the managed care plans. That's the Delta Care Plan and the Willamette Plan. So just as a refresher, under the Uniform Dental Plan, it's a Class 3 covered service, which has a 50%, it's split 50-50 between the plan and the member. And that's something that's been talked about as part of the UDP potential benefit enhancements in the future. On the Delta Care and Willamette side, it's a flat copay that ranges between $100 and $175. And what exactly determines where it falls on that range is the specific materials that are used in the crown. I believe there are 3 or 4 different types of materials, and the cost is fixed depending on what the material is, but it ranges on the low end of $100 to the high end on $175. And so that's what the coverage looks like in those 2 specific plans. I want to see if there's any other follow-up on that I can try to provide. If not, that's the one piece of follow-up that I had from the last board meeting, and so I will turn it back over to you, Lou.
All right, thank you. The Uniform Medical Plan, RFR 2022 for benefit year 2023. Jenny Switzer, Senior Account Manager in the IRB Division, is bringing us back 2 resolutions for action today. She's also going to introduce a new proposal resolution for board action at the next board meeting. After Jenny reviews each resolution for action, I'm going to read the resolution. I'm going to ask for a motion to adopt. A second. I'm going to invite for public comment. And then I'm going to ask for discussion from the board until we're ready for a vote. After our vote, Jenny will introduce a new proposed resolution, and our materials are behind tab number 4. Morning, Jenny.
Good morning, Chair McDermott and members of the board. Like Lou said, my name is Jenny Switzer, and I'll be presenting on Uniform Medical Plan resolutions for benefit year 2023 for your action. These were previously shared with you at the June 2nd board meeting by Christine Davis. Additionally, I'm going to present on that new resolution that will require your vote at an upcoming meeting. Are the slides presenting?
I'm not seeing the slides. I was wondering about that.
We're checking on it right now because I beat you both. I beat you both to the punch.
Okay. I thought it was the setting I had. I was like, what have I done? I had it and then it was gone.
I know. I was like, my face looks really big on this screen for something to be presenting.
You were on my 55-inch TV. You were the whole show.
That's horrifying. Thank you.
Well, I'm glad, Lou, that you mentioned we're a little bit more dispersed in the state today. That was hopefully didn't jinx us, but did was prescient.
No, we'll get this.
I don't know if I have presenter rights, but I could, if I do, I could present.
I was just thinking the same thing, Jenny. So, Jessica, I'm not sure if that's something you can grant Jenny as well.
Why don't you just give it a shot, Jenny, see if it goes through, and if not, we'll try and get that setting fixed.
All
Yep.
right. All right. Let me get into present mode here.
There you go. That looks like it's working.
All right.
Takes a village. Nice job, Jenny.
All right. So the 2 recommendations for your action that we will be reviewing are Resolution 2022-02, which indicates a proposal to increase the IRS minimum deductible amount for our high deductible health plan. The second resolution is 2022-03, which HCA proposes to allow certain prescription drugs to be covered pre-deductible per guidelines from IRS Notice 2019-45 for certain conditions. As derived from IRS Revenue Procedure 2022-24 for benefit year 2023, HCA proposes to increase the minimum deductible for single subscribers from $1,400 to $1,500 and all other family or partner tiers to increase from $2,800 to $3,000. For additional context, the SEB plan was implemented in 2020 and was fully leveraged from PEB portfolio, which launched in 2012, including mirroring the deductible amounts. There have been no deductible increase since the inception of this plan in 2012. After a decade, it is necessary to increase the minimum in order to maintain an IRS qualifiable high deductible plan. Bringing this resolution back to you, this language is unchanged from the SEB board presentation that took place on June 2nd. A similar resolution is being presented to PEB. This resolution was sent out for stakeholder feedback. Since this was presented to the board on June 2nd, we received 2 responses from stakeholders. Both were generally supportive. Board members will receive a copy of emails we received, plus an Excel spreadsheet outlining these questions.
And Jenny, just to clarify, those should have been attached to the briefing book when they were sent to you. So you said it in the future tense. It's already happened. Just wanted to clarify that for folks.
Thanks, Dave. Magical. It's already taken place. This slide was presented in, oh, hold on. Sorry, more technical difficulties. We're not getting to that slide yet. Okay. Sorry, everybody. This is a fun meeting.
So Jenny, I think you finished presenting and
Yeah,
you're back to the resolution to see if there's any questions from the board. And if not, you're handing it over to the chair.
that is correct. Thank you.
All right.
Yep. Are there any additional questions or comments from the board before we refer back to Chairman McDermott?
All right. Jenny, thanks for improvising. Appreciate it. We're going to go ahead and vote on Resolution SEB 2022-02, IRS minimum deductible for high deductible health plan. Resolved that beginning January 1st, 2023, the deductible in the UMP high deductible plan will be increased to $1,500 for a single subscriber and $3,000 for all other tiers. Is there a motion to adopt?
This is Dan, so moved.
Thank you, Dan. Is there a second?
Pam,
This is Allison.
second.
Oh. We're trying to move it along for you, Mr. Chair.
I appreciate it. We've got, I think we have Pam and Allison with the second. Any comments from the public? Dave, and we'll do this one together. We'll review. I'm not seeing any hands up. Any comments from the board? Again, no hands. So this is going to be a roll call vote, starting with Terry House.
Yes.
Allison,
Yes.
Pamela,
Yes.
Pete,
Yes.
Carrie,
Yes.
Amy,
Yes.
Donna,
Yes.
Dan,
Yes.
and myself, Lou McDermott. Yes. Resolution SEB 2022-02 passes. Jenny, the next resolution, please.
Okay. Who knew that voting would be the easiest part of this presentation for me? Okay, so this slide was presented in 2021 when the medical components of this notice were addressed, and this slide helps to give context to the notice. IRS Notice 2019-45 expands the list of preventative care benefits that UMP may cover pre-deductible. These services would be classified as preventative per the order, but can still be subject to member cost sharing. The board voted on the medical components in 2021 with SEB Resolution 2021-15, which is included in the appendix for reference. HCA is recommending that the UMP high deductible plan provide coverage for certain high value drugs within each drug class specified in IRS Notice 2019-45 pre-deductible. The specific drugs that are part of HCA's recommendation were presented in the June 2nd meeting, and those are included in the appendix of this presentation as well. Bringing this resolution back to you, this language is unchanged from the presentation that took place on June 2nd. A similar resolution is being presented to the PEB board. Since this was presented to the board on June 2nd, we received 2 responses from stakeholders. One was in support of the resolution, and one was clarifying the assumption that this list of drugs is consistent with IRS guidance on drugs allowed to be covered pre-deductible for high deductible health plans, which is correct. Board members did receive a copy of those emails we received and an Excel spreadsheet outlining those questions. Are there any comments or questions before I refer back to Chair McDermott on this resolution?
Seeing none, let's have a vote. Resolution SEBB 2022-03 UMP high deductible preventive care. Resolved that beginning January 1st, 2023, the UMP high deductible plan will cover the drug list presented to the board on June 2nd, 2022, prior to meeting the planned deductible. Prior to meeting the planned deductible. Thereafter, HCA may alter this drug list to allow for pre-deductible coverage based on clinical evaluation in accordance with IRS guidelines. Is there a motion to adopt?
Pam Cruz, so moved.
Thank you, Pam. Is there a second?
This is Dan, I'll second.
Thank you, Dan. Any comments from the audience? Seeing none, any comments from the board? Seeing none, this will be a roll call vote, starting with Terry.
Yes.
Allison.
Yes.
Pam.
Yes.
Pete.
Yes.
Carrie.
Yes.
Amy.
Yes.
Donna.
Yes.
Dan.
Yes.
And Lou, yes. Resolution SEBB 2022-03 passes. Jenny, please continue.
Okay, moving right along. Here I have a new proposed resolution, SEBB 2022-04 for UMP accumulator transfers between boards when a subscriber remains within a UMP plan. No action is required of the board today. A similar resolution is being presented to the PEB board. This will require a vote in an upcoming subsequent meeting. Currently, when a subscriber moves from one board to another, all of their accumulators start over, which means that they would start with $0 applied towards their deductible and out-of-pocket limit when they start with a new board. UMP is recommending that certain accumulators follow the subscriber when they switch boards mid-year due to a special open enrollment, as long as they remain within a UMP plan beginning on 1/1/2023. All accumulators currently follow the member when they switch plans within the same board mid-year due to a special open enrollment. So this change would result in a more equitable experience for UMP members who leave the PEB board and join a UMP plan under the SEB board. This resolution would result in accumulators for deductibles and out-of-pocket limits to follow the member, resulting in lower cost share for the member. A similar resolution is being presented to the PEB board later this month, and this change would need to pass both boards to be implemented. All right. Here you can see UMP's recommendation that beginning January 1, 2023, when a subscriber enrolled in a PEB program uniform medical plan changes their enrollment to a SEB program uniform medical plan during the plan year due to a special enrollment, not including open enrollment, accumulated deductibles and out-of-pocket maximum expenses for both medical and pharmacy will transfer with the subscriber. Are there any questions on this topic that I can address today?
Jenny, I just want to add for the board that the similar concept is included within the fully insured plans books of business as part of this upcoming rate cycle as well. But we don't ask the board to vote on individual components of the fully insured benefits in the same way that we do of the control of the self-insured benefit managed by the state. But just know that this same accumulator rollover concept crossing programs is included within the fully insured rates that you will see next month.
All right, thank you, Jenny.
Oh, I see Pam.
Oh, hey, Pam.
Okay, I'm going to ask a silly question just because, we go from SEB to PEB and PEB to SEB. And maybe it's because this will be our resolution and then PEB will do a similar reciprocal one where it says if you go from one to the other, you would have the same type of, you could bring along your accumulated funds. Is that the plan?
Yes, Pam. The one of the challenges we have is you can control what happens when someone comes to you, but you can't dictate what happens when someone leaves you. And so the mirror version of this exists for the PEB program where change the words PEB and SEB, swap them, and that's the PEB version of it. But each board only has specific authority over the membership once they are entering your program. And so we've always got to think very carefully about the wording of it. And that's why we also try to highlight when a vote is kind of contingent on both boards happening. That way it's, the full puzzle pieces come together. But unfortunately, each board can't control what happens when somebody leaves their program.
That's why we ask you the questions, Dave.
Mm-hmm.
Other questions? All right. Thank you, Jenny. Appreciate it. Next agenda item, Kaiser Foundation Health Plan of Washington options. Proposal of Summit PPO plans. Lauren Johnston, SEB Procurement Manager, Herb Division, is going to share proposed updates to the Kaiser Washington options plan offerings for the 2023 plan year. Her materials are behind tab number 5. Lauren, welcome.
Thank you, Chair McDermott. Dave, should I share or are we ready to go?
I think Jessica is ready to go or Jamie's ready to go. Here we go.
Okay. All right, let me adjust some things so I can see. Thank you, Chair McDermott, members of the board. Again, my name is Lauren Johnston and I am the SEB Procurement Manager in the Employees and Retirees Benefits Division. Today, I'm going to be walking through with you the Kaiser Foundation Health Plan of Washington Options Incorporated proposal of Summit PPO plans. Next slide, please. The objectives of today's meeting are to introduce those KPWA options, Summit Preferred Provider Organization, so Summit PPO plans, and to answer the following questions. First off, we know that people are going to be wondering why Kaiser is proposing this change and why HCA would recommend making the change. We're also going to discuss what members can expect, how many members are impacted, as well as the transition support that will be provided to members. So first off, why Kaiser is proposing this change. Kaiser always has, their goal and their mission is to provide high quality, affordable healthcare to members. So implementing these plans would help them continue their goals with that. It's also assumed that subscribers will see a reduction in premium and cost shares. And right now we're saying assumed reduction in premium because that part of the negotiations is not quite ready to be shared yet. There's still a team approach to care. It's going to be coordinated with the member's personal physician, also referred to as a primary care physician, and all connected to the member's electronic health records. Members are still going to be receiving evidence-based care, and there's also going to be a lot of care management with the focus on helping to reduce the need for hospital stays and readmissions. Just something else to point out here when it comes to a team approach care is that if a member does not see a Kaiser Permanente provider, that Kaiser's care team will connect with their primary care provider to make sure that the member's care is all in connection. Next slide, please. Why HCA recommends this change. So we want to make sure that we're supporting Kaiser's goal and mission in providing high quality, affordable health care. It's also to continue to meet the aims of better health, better care at lower costs. The summit plans are more affordable to both members as well as the state, and benefits continue to be value-based and understandable to members. Some things that members can expect: the same savings when members seek care from Kaiser Permanente care teams. So the enhanced benefit that they had when they were on the Access PPO, they would still have on the Summit PPO as well. There's going to be an expanded list of specialists covered as in-network. There are similar pharmacy savings as well as the first fill program, which we discussed at the June 2nd meeting and is also included in the appendix of this presentation. There's going to be some tier 1 hospitals. So when a member sees a tier 1 hospital, they will pay a 10% coinsurance instead of the current 20% under the Access PPO. But members will still have full access to tier 2 hospitals as well. But if they go to a tier 2 hospital, they would pay a 30% coinsurance. They're also members right now on the Access PPO are familiar with the First Choice Health Network in Alaska, Idaho, Montana, Oregon, and Washington. So very similar, but it's going to be a little more customized for the Summit PPO plans than it was for the Access PPO. And members who live throughout the United States, other than those states that I just mentioned, will still have the same access to the First Health Network. Just want to touch base a little bit on the tiered provider structure, because when we get into the benefit design, you're going to see tier 1, tier 2, tier 3. So member cost shares are the lowest for tier 1 providers and the highest for tier 3 providers. Keeping in mind that only Kaiser Permanente providers are tier 1 when it comes to primary care. All other primary care providers are tier 2. Next slide. So these next sets of slides that you're going to see, we're going to be doing a comparison between the Access PPO versus the Summit PPO. As you can see there, the Access PPO is on the left-hand side and the Summit PPO is on the right-hand side. And although some of the benefits or deductibles, cost shares, et cetera, might be the same under the Summit PPO as in the Access PPO, we've still underlined and italicized those just to help emphasize the fact that these are new plans that members are seeing. All right, so to kind of give a summary of this, so this would be the member's medical deductible as well as their medical out-of-pocket limit. So taking a look at the Summit PPO 1 versus the Access PPO 1, the per person for tier 1 and tier 2 providers for the medical deductible, the per person deductible is the same limit. So it's the same level there at the $1,250 per person. But if you see tier 1 and tier 2 providers, your family deductible is lower than it would be under the Access PPO. So we're going from $3,750 in the Access PPO for a family to $2,500 in the Summit PPO for a family with tier 1 and tier 2 providers. If members see tier 3 providers, though, their deductible will go up, because tier 3 is basically out of network. So incentivizing that members see in-network providers at that tier 1 and tier 2 level. And looking at the medical out-of-pocket limit, as you can see there for tier 1 and tier 2, it's the same limit at the $4,500 per person or $9,000 for the family as it is under the Access PPO 1 plan. For tier 3 providers, there is no out-of-pocket limit for those out-of-network providers. Next slide. This slide shows what the pharmacy annual costs are going to be. So no difference here between the Access PPO and the Summit PPO plans. No pharmacy deductible for either plans, and and the pharmacy out-of-pocket limit is combined with the medical on both plans. Next slide. All right, so kind of taking a deeper dive into the pharmacy benefit, this slide shows the pharmacy tiers for a retail pharmacy for 30-day supply. So some of the cost shares here, depending on what tier the member is receiving, are a little different and sometimes a little higher. So if we take a look at the Summit PPO1 plan versus the Access PPO1 for preferred generic, you can see that it would be going from $10 on the Access PPO to $20 in the Summit PPO, with the enhanced benefit of $10. So if members see a Kaiser pharmacy, they would receive that $10 copay for the preferred generic, which matches that $10 under the Access PPO if they were to see any pharmacy. And there's some other differences throughout this slide as well for all three plans, depending on the tier drug that the member is filling.
Lauren, can you confirm when specifically in the context of generics, often these charts say $10 or $5, but is this also an instance where it's up to $5 if the actual cost is below $5 or below the number that's on the page for a generic, that they pay the actual cost, not $5 or $10? Okay.
Yes, that is correct. Yep.
So it's really up to that amount on the generics row.
Yes. Oh, next slide, please. Sorry. All right. So this slide here is taking a look at the office and clinic visits, as well as mental health office and clinic visits and telemedicine and virtual care. So just making a note that primary care copays are for ages 18 and over. That primary care for ages 0 to 17 is still at that $0 level. So no cost share to the member under the Summit PPO 1 and 2 and 3 plans. So taking a look at Access PPO versus the Summit PPO for office and clinic visits, you can see there that when it comes to primary care, if a member were to see a tier 1 provider under the Summit PPO, they would be paying $10 less than if they were to see a primary care physician under the Access PPO. So you can see the $20 versus $20 enhanced benefit under the Access PPO. That's because under the Summit plans in tier 1 are those Kaiser providers only for primary care. And then the specialist dollar amount for tier 1 is the same between both the Access PPO and the Summit PPO at $40. And then you can see there that the tier 2 providers, the dollar amount goes up for both for both primary care and specialty care under the Summit plans. Any questions on this slide before we move on? All right, next slide, please. So very similar to the last slide. Again, primary care copays shown are for ages 18 and older. For ages 0 to 17, primary care would be a $0 cost share to the member. This slide is going through the rehab therapies. So occupational therapy, physical therapy, speech therapy, and neurodevelopmental therapy. On the top there, we've got the visit limits. So no change in visit limits between the Access PPO and the Summit PPO plans. The outpatient cost shares, there is a difference here between what someone would pay under the Access PPO plans versus the Summit PPO plans. Again, you can see on the Summit PPO, they've got that tier 1, tier 2, and then broken out again into primary care versus specialist. So you can see there that the Access PPO 1 copay amount for an outpatient office visit is $40 versus if you were to see a primary care under tier 1, which would be $20, or the specialist, which matches Access PPO at $40. And then for inpatient cost shares, kind of like what we mentioned up above in one of the slides, those tier 1 hospitals under the Summit PPO are covered. The member would be paying a 10% coinsurance for tier 1 or a 30% coinsurance for tier 2 hospitals versus under the Access PPO plans where the member would pay a 20% coinsurance. Next slide.
Lauren, one thing, just to reassure folks, you will show the tier 1, 2 networks and the various networks on subsequent slides at some point, correct? They're in the appendix.
Yes, yes. So we have some examples of what those providers would be. Yep.
Just want to make sure that people know that that's coming.
Yeah. All right. So taking a look at the Kaiser proposed 2023 service area. So what this slide shows is the new service areas. So KP Wa Core 1, 2, and 3 are going to be the only plans in that lime green color now. So what used to be shown is that Whatcom, Skagit, Island, Mason, and Lewis counties were also part of that blue. Were also blue. So they are now moving to green because they're going to be core counties where core plans now are offered only. So what that means is that KPWA will no longer have any PPO options available to members in Whatcom, Skagit, Island, Mason, or Lewis counties. Next slide. This is kind of just taking a look at that other slide slightly differently. So the light pink colored tiles are those 5 counties where KPWA will no longer have a PPO option available. So just kind of getting into the numbers now, what this means is that with Kaiser-Wa moving out of those counties with their PPO, that 1,349 members will no longer have access to a Kaiser-Washington PPO plan. So these 1,349 members will still have access to Kaiser Core 1, Core 2, and Core 3 if they want to remain with Kaiser. And if they choose to stay with a Kaiser Core plan, they'll need to transfer their care to Kaiser providers. Or if they would prefer to stay with a preferred provider organization plan, they will have access to UMP Achieve 1, UMP Achieve 2, and UMP High Deductible, as well as the Primera High and Standard PPO in all 5 of those counties. And then for those members in Skagit County, they will also have the option to enroll in the UMP plus UW Accountable Care Network. Next slide.
Oh, wait, let's wait a second. Pam has a question.
Oh, okay.
I don't know if it's so much of a question, but just something for us to keep in mind. At living in the greater Puget Sound area, life is great. But, our members live on the far eastern side of the state, on the far northwestern part. If we could just keep an eye on making sure we have as many options as possible for our members who live on all 4 corners of the state. And I know some of that is out of our control, but I wanted to put that in the room.
Thank you, Pam. Next slide. All right, so kind of thinking about that 1,349 number. So what this slide shows is the plan choices for current access PPO members that are outside of that Summit PPO service area. So this 1,349 members. So taking a look at that far right column, the percent of members who are paneled with a KPWA core HMO provider. If we take Island County as an example, so what that means is that the 340 members who currently live in Island County, 34% of them are already seeing Kaiser providers. So for that 34%, those individuals may choose to stay with a KPWA core plan 1, 2, or 3, and then still have access to the providers that they're currently seeing. So that's just kind of to give you an idea of what this slide is showing. Otherwise, those 340 members in Island County would have the option of 6 other plans that are available to them. As you can see there in Lewis, Mason, and Whatcom County, the number of members that have 8 plans available to them, and then in Skagit County, 9 plans available to 309 members. Next slide, please. All right. So this slide basically just shows, so if I were a member right now in this past year's open enrollment, and I were thinking about what plans I might enroll in plan year 2022, taking into account that these are the plans that I have available to me still outside of those KPWA access PPO plans. So if I were considering what plan I was going to enroll in for 2022, I might have said, oh, you know what, I'll look at the UMP high deductible. for a subscriber only employee contribution of $25 only. My deductible is $1,400 and my out-of-pocket max for a single subscriber would be $4,200. Or I might say, okay, if I had chosen Kaiser Walk or One instead of maybe like the Kaiser Walk Options Access PPO one, I would have paid $39 as a subscriber only. I would have had a $1,250 deductible at a $4,000 out-of-pocket maximum. So this is just to kind of give you an idea that had members considered that are in those 5 counties considered other plans, that this is kind of to give a ballpark of what it would have looked like for them or what it could look like next year. Next slide, please. So there will be transition support for subscribers. So notifications will be sent to subscribers from both HCA as well as Kaiser of Washington. So Kaiser will provide customized letters and emails to subscribers. Subscribers in Island, Lewis, Mason, Skagit, and Whatcom counties will be given links to the core network and the potential to enroll in one of the HMO plans. So Kaiser Core 1, Kaiser Core 2, Kaiser Core 3. Subscribers in King, Kitsap, Pierce, Snohomish, Spokane, and Thurston counties will receive a letter illustrating the benefits of the Summit PPO plans. And all members and potential new members will have access to customized videos for Summit PPO, and that'll be provided through the virtual benefits fair that the SEB program puts on, as well as Kaiser's microsite. There's going to be a customized microsite with links to provider networks and plan design comparisons, as well as drug formularies provided by Kaiser. And there's going to be open enrollment webinars provided by Kaiser as well. And if members have questions, they're encouraged to reach out to Kaiser's customer service team. They are very familiar with the Summit PPO plans and are ready to answer questions that members might have.
Lauren, can we go back to slide 15 for a moment? I just want to highlight one other piece. With this particular proposal, one thing that I think is important to highlight that isn't really in play is, and I realized isn't on this slide right here, is the price point of the access PPO plans that exist today. And so that top section that has the $1,250 deductibles along with the UMP high deductible, the premium that a single subscriber is paying in 2022 for the access PPO one plan is $104. And so if somebody wants a similar plan design and they're switching either carriers or staying within Kaiser, continuing to see Kaiser and going to the core product, that does represent also a significant premium difference to the member's favor. The same goes for access PPO2 when you're looking at $750 deductible plans. The premium for a single subscriber in 2022 is $133. So again, there is a substantial premium difference to the member's favor in that instance as well. And then also when you get to access PPO 3, which is that $250 deductible in that next to last bucket, the premium currently for access PPO 3 for a single subscriber is $185. So in all of these instances, yes, there are important considerations about if you're seeing a Kaiser provider, do you want to move into a core product and continue seeing those Kaiser providers? And Lauren highlighted the number of individuals who are already seeing Kaiser providers who may naturally make that transition. I know many of us that spend our days in insurance often think that a lot of individuals may struggle to switch either from an HMO to a PPO or a PPO to an HMO because they fundamentally believe in and appreciate or are comfortable with one of those philosophies over the other. And in this instance, because many people are already seeing Kaiser providers, that switch may be easier for them. Others would need to switch carriers and may or may not have to have a provider switch, but at least one thing that is part of this overall swap of plans, if you will, from access to Summit. It should not include, for those individuals who are in those 5 counties, something where they're also going to pay more. They will also pay less is what this all shakes out to be. And I wanted to highlight that specifically.
Thanks, Dave. And then next slide. Oh, okay. So this is a corrected slide from the June 2nd, 2022 presentation. within the Primera slide deck. So the Primera 2023 proposed benefit change. Originally for the CAM services, it was for the Primera standard PPO plans, it was showing a 25% coinsurance that was moving to a $25 copay. The coinsurance under the Primera standard PPO is 20%. So that 25 should have been 20%. So 20% to $25 copay under the Primera standard PPO plan for acupuncture, chiropractic, and massage therapy. Next slide. So again, any questions? Here's my email, and feel free to email me questions or ask them here today. And then the appendix, if you want to move to that really quick. Yep, next slide. So this is, so sorry for that first slide there, the first fill pharmacy program. Just wanted to include that here in case anyone needed a reminder of what that looked like. And then for the next two slides, we've got the Summit PPO Tier 1 per specialty. So these are examples of providers who are in under the Summit PPO as Tier 1 specialty providers. As you can see, and a lot of them are very, familiar names. And then next slide. Summit PPO Tier 1 hospital examples. So these are the hospitals that examples of hospitals that a member would pay that 10% coinsurance at. And that's everything from me.
Any other questions for Lauren? All right, seeing none, Lauren, thank you so much. Appreciate your time.
Thank you.
And we're at the public comment portion. Is there anyone on Zoom that would like to provide comments? We're going to gather a list. Well, we kind of were gathering a list before, but I'm just going to sort of wing it now. So if you put your hand up, I will call on you. Dave, I'm not seeing any. Are you?
I'm not seeing any either, but I'm also checking as well. Nope, I don't see anyone either.
All right. Our next meeting is going to be July 7th, 2022, 9 a.m. to 2 p.m. Dave, any final comments before we adjourn?
Just a couple of things. We'll be bringing back at the next board meeting the UMP accumulator resolution that Jenny introduced today after sending that out for stakeholder review. We also anticipate that we will be bringing you at the next meeting the 2023 rate proposals. And so that is a hallmark of the month of July. And so those are the key things that we'll be rounding out the rest of the board season with. One other topic that I just want to highlight for you, just because there are two large programs, the PEB and the SEB programs, and there's a significant proposal in the PEB context that's currently under review in the retiree setting. I just wanted to let you know that if you do receive or have questions about that, you can reach out. We are planning to bring a presentation about that PEB retiree proposal because ultimately, as I say, the vast majority of SEB members who retire typically have eligibility in the PEB program, and we want you to be aware of what's going on there. It's a very organic and fluid topic at the moment, and so just wanted to bring you kind of up to speed as we were ending the board season. And so it's very deliberate. We will be bringing you information if you are hearing about it, and if you do have questions, do feel free to reach out about it. That specific proposal right now is about closure of the UMP Classic Medicare plan for the Medicare population. It does not impact the employee population in either program or the non-Medicare population that exists within the PEB program. So that's why it hasn't been brought up here at this point, but I did want to just to clarify for you, if you are hearing about that, because I know some of you are, if you have questions, feel free to reach out, but there will be a presentation about the then status of that proposal once we get to the end of this board seasons. And with that, I will turn it back to you, Lou.
All right, Dave, thank you to you and your staff, obviously, for all the presentations, the information. Board members, thank you for attending, and the public. This meeting is adjourned.